Hi, this is Matt Coates. I'm the executive director at NAMI Montana, and we're doing a short series of videos about kinds of wins and losses in the Montana legislature. And this is a loss. This is definitely a non-win. We had started in the interim with a bunch of other folks, but we had asked Senator Walt Sales to bring in an interim study for last time, looking at a different reimbursement model for Montana's mental health system. Ours has failed, just completely failed, tragically failed for our medicated fund services, and really collapsed in 2017. COVID and the workforce challenges have only just exacerbated that. So everybody knew that there was a problem with how we were funding our mental health treatment system. So NAMI Montana and Senator Sales asked for this study, and organizations came and presented from around Montana and from around the country, really talking about what models we could use to better improve how we reimburse for behavioral health care in Montana. And the model that rose to the top is the Community Certified Behavioral Health Center model, CCBHCs. And hopefully I got that right. But CCBHCs is the model, and it is a different way of reimbursing for this. It is a model that has really come to the forefront in recent years. There's a ton of support by Congress, ton of support by both the Trump administration and the Biden administration for it. So this is a direction that Medicaid behavioral health care funding in the United States is moving. It has more outcome measures than before, so it is also pushed towards cost-based reimbursement, which we believe at NAMI Montana is incredibly important. We can't keep expecting Medicaid providers to deliver care for folks that desperately need it at reimbursement rates that don't match their expenses. That isn't going to work. Hasn't worked in the past, and it certainly isn't working now, and it won't work in the future. So this is a model that looks a little bit more like the federally qualified health center model, and we're excited about it long term. And there is some good news that Montana is one of the states that has gotten CCBHC grant funds from SAMHSA, and we were just awarded another grant for CCBHCs, and Montana DPHHS really needs to be applauded for that. Governor Gianforte's office needs to be applauded for that, because they went after it, and in the course of the past 2 years, they really have committed to CCBHCs. Governor Gianforte's office and the Department of Public Health and Human Services underneath him has committed to the CCBHC model and making it work in Montana. Unfortunately, we were not able to get a bill passed the Montana legislature to guide us in the implementation of that model. But we certainly will keep pushing. We were really grateful to Representative Ed Staffman, Representative Jane Gillette. Both carried bills, good bills, that would have implemented CCBHCs in Montana. Unfortunately, we just could not get them through. We could not get the support for them. My hope is that this was just too big of a lift to be able to do in one session, and that we will be able to do that the next session. Like I said, we got a lot of support by the governor's office, a lot of support from DPHHS, and there are community providers that are rolling out the CCBHC model in Montana. as we speak. So I am hopeful. I am excited for it. I think that we'll get there. We just weren't able to get there at this time. Thank you.